To welcome you to our session of Ask Me Anything. My name is Jim Coverdell. I'm a professor and the department head here in sociology at the University of Georgia. My work is mostly in work and organizations. So I've written a couple books on headhunters, and I have a new book coming out. The page proofs just arrived today. Early next year on how surgeons are struggling with efforts to reform their work hours. The Franklin College of Arts and Sciences is, of course, a vast enterprise ranging from art and religion to the sciences and social sciences like sociology. There's increasing interest in collaboration among scholars in very different sorts of units. So we increasingly see calls for an encouragement for people, say, in sociology to collaborate with scholars in biology or genetics, in medicine. So I, for example, collaborate with a number of MDs in the research that I do. And this is something that's really quite an important and I think really transformative force on campus, sort of the collaboration and interdisciplinary quality of the work that we're doing. And that is a natural way to introduce our speaker today. Dr. Ryon Cobb is a PhD from Florida State University in 2013. He went to the University of Southern California, did not one, but two very prestigious postdocs that introduced him very fully to the world of collaborative research, where people are looking at biological processes and incorporating social science into their analyses. And he is really an exemplary scholar in that respect. So he spent 5 years at the University of Southern California on postdocs, spent a couple years at the University of Texas at Arlington in their School of Social Work. And we were thrilled in December to get him to sign on the dotted line to come and become part of the University of Georgia and to join us this fall. So Ryon is our shortest tenured person in the department. He started, well, Saturday, officially yesterday here at the University of Georgia. And we're already putting him to work by talking a bit about his research. So Ryon's research is grounded in an interest in race and ethnicity, and disparities in health and health outcomes. He also has studied religion in the past and in the present, so he's got a kind of interest in a couple of areas. But I think what is really exceptional about Ryon is his ability to think about how social processes, things like experiencing everyday or major forms of discrimination, can shape aspects of our bodies that then produce different health outcomes for different groups of people. Like we're looking at social processes shaping biological processes, which in turn shape health outcomes. And this is really, I think, an exceptional area of research. And we are thrilled to have Ryon joining us this term. And take it away, Ryon.
Perfect. Hello, everyone. My name is Jim mentioned. My name is Ryon Cobb, Assistant Professor, Department of Sociology at University of Georgia. Today I'll give you a slight overview of research my colleagues are doing are related to COVID-19. So let me share screen. So today's presentation is entitled, Why Does COVID-19 Affect Us Differently? And specifically, I'm interested in something called psychological distress. And so why does COVID-19 affect psychological distress among Blacks, whites, and Latinos differently? Let's go brief overview. So what we know about the coronavirus, or specifically COVID-19. Number one, coronaviruses are a large family of viruses that can cause some illness in both animals and humans. Examples include COVID-19, Middle East respiratory syndrome, severe acute respiratory syndrome. Typically, coronaviruses lead to illness such as the common cold. But as we've seen more recently, other strains of coronavirus, COVID-19, lead to respiratory illnesses and, in many cases, death. Research from the CDC, both in the United States and abroad, suggests the US leads the world in COVID-19 related cases. Figure 1 derives from the European CDC. It looks at the daily confirmed cases of COVID-19 on a rolling 3-day average, beginning in February 11th in 2020, until recently of August 4th. And we can see that the United States, while between February and March, was very similar to other countries. We see that the number of cases have increased. It seems to be dropping, but still much higher than other nations, in part due to massive testing. Research also suggests that the United States leads the world in COVID-related deaths. This again comes from the European CDC. It shows the daily confirmed COVID-19 deaths on a rolling 3-day average. In comparison, North America, which would be this green portion right here, in comparison to other nations, continents, Africa, countries, Oceania, South America continent, Europe, Asia, excluding China and China. As we can see over time, that this green portion of the bar represents North America, that increasingly the United States has become the leader in COVID-19 related deaths in the United States. We also see COVID-19 has increased what we call excessive deaths in the United States. And so this data comes from the Center for Disease Control, and it examines the weekly number of deaths in the United States 2020, including and excluding COVID-19 from all causes. The orange line represents the threshold for excessive deaths. The positive sign that's in red indicates the observed count above the threshold, and the green represents, the green bars below represents the predicted number of deaths excluding COVID-19, and the blue bars represent the excluded number of deaths including COVID-19. As we can see, particularly in the summer, leading from the spring into the summer, that there's an increase. First, the increased threshold of death was met in the January was the January 1st through the 18th. And we've also seen increased number of deaths, but we see beginning shortly after April, there's an increased number of deaths, and based on the blue bars that they're related to COVID-19. So COVID-19 is not only leading to increased deaths, there are not only increased deaths overall, but also we see a higher predicted number of COVID-19 related deaths. So generally as well, it's increasing us above the threshold. The next figure also comes from the Center for Disease Control. This shows the weekly number of deaths in 2020 relative to 2019 by race and Hispanic origin. We can see from this figure that Blacks specifically, that the COVID-19 and how it shapes deaths in the United States varies by race and ethnicity. And so the differences and increases for deaths we see is relatively small for whites, but we see in some cases 100% increased in the average, the weekly number of deaths we saw this time in the previous year. Although it's dropping, we can see that both Blacks and Hispanics, that they bear the brunt of COVID-19 related deaths. And so though Blacks represent, I believe, 11% of the general population, they're overrepresented in COVID-19 related deaths, as we saw previously in the media, as well as the proportion of Blacks that are dying and relative to the same time between 2015 and 2019 has also increased exponentially. Blacks are not only increasing death, as Blacks are also bearing, Blacks and to a lesser point as Latinos, the burden of COVID-19 also they also disproportionately bear the burden of COVID-19 related outcomes. And so this data is from the Pew Research Center. It looks at the proportion of adults who know someone who's been hospitalized or died due to COVID-19. This was filtered between April 7th and 12th. And we can see that the general population, only 15% of adults in their sample responded yes, that they know someone who's personally been hospitalized or died as a result of COVID-19. And though 13% of whites and 13% of Blacks respond yes to this question, we see that 27% of Blacks in between April 7th through 12th responded yes to the question, suggesting that Blacks relative to Latinos and whites, that they know more individuals, or higher proportion of Blacks know more higher proportion of Blacks experience COVID-19 through a personal family connection, either being hospitalized or death. There is one outcome where we don't see some differences in, and that's mental health. And so this data is from an internet panel of survey of respondents filtered by the Brookings Institute. And so research suggests that number one, although the burden of COVID-19 is higher for among minorities and particularly Blacks than it is for whites, Blacks in this study report better mental health and optimism than whites, with the most significant difference being between low-income Blacks and whites. Latinos also score higher than whites on life satisfaction and optimism, and have slightly better mental health than whites, but the gaps are not as large as between Blacks and whites. And the study also finds that Blacks across all incomes who lost their jobs are both more optimistic and report better mental health than whites who have not lost their jobs. So in sum, despite bearing the brunt of COVID-19 as it relates to deaths, both deaths, hospitalization, and cases, both themselves, as well as in their close personal networks. We see that Blacks still remain more optimistic in this case, as well as happier than their white counterparts. And this finding goes into a long line of research, which suggests that more generally, the racial paradox of mental health suggests more generally that Blacks have better mental health across a range of outcomes than their white counterparts. And this is somewhat shocking given their Blacks on average low socioeconomic position in the United States. Now, this research, the presentation today will focus in on how does discrimination or unfair treatment, particularly racial discrimination attributed to one's race, somewhat complicate our understanding of how race connects to mental health in the COVID-19 era or its period, COVID-19 period. And so research suggests that, number one, not surprisingly, that when the Pew Research Center in 2019, they asked respondents how they personally experienced discrimination or been treated unfairly because of their race and ethnicity. Only 3% of whites said this happens regularly. 30% of whites suggest that this happens from time to time. The rest suggest that it did not happen. We see that that's not the case for Blacks, Latinos, or Asians, where 13% of Blacks suggest that they experience racial discrimination on a regular basis, compared to 63% and 63% of whites 63% of Blacks experience racial discrimination on a from time to time. 9% of Latinos experience racial discrimination regularly, and 11% of Asians experience racial discrimination regularly. So we see the take-home point for this is that Blacks bear the burden of experiences of racial discrimination in the United States. Research also suggests that Blacks, despite bearing the burden, that they also have better mental health, in this case, lower levels of psychological distress relative to their white and Latino counterparts. This data is from the Pew Research Center, which was fielded shortly after the nation shut down due to coronavirus outbreak, and suggesting like in March of 2020 that Blacks reported lower levels of psychological distress. The mean score, at least, for Blacks' psychological distress scores was lower than that of whites and Latinos. This figure also looks at how psychological distress by discrimination, and consistent with prior research, we see that that those who face discrimination or racial discrimination on a regular basis report higher psychological distress scores than their counterparts who experience racial discrimination from time to time, or on those who do not report discrimination. So essentially, discrimination is a risk factor for higher psychological distress scores among adults in the United States. The next figure looks at how race combines with age. How experiences of discrimination combine with race to shape psychological distress scores. We can see among whites and among Blacks and among Latinos that those with the lowest psychological distress scores are lower for those who do not face any racial discrimination, and they increase if individuals experience discrimination from time to time, almost in a stepwise fashion, as well as those who experience racial discrimination on a regular basis report the highest psychological distress scores. But we see with the case for Blacks, if we're looking at the mean scores across different racial groups, that even Blacks who face the highest racial discrimination on a regular basis, that their psychological distress scores are lower than for whites who face discrimination from time to time, and lower for whites who face discrimination on a regular basis. The same holds true if we compare those to Latinos, that they're Blacks who face discrimination, report experiencing discrimination on a regular basis, still have psychological distress scores that are lower than their Latino counterparts who face this racial discrimination regularly and from time to time. Suggesting that, and these research suggests that Blacks who have experienced discrimination relatively since the beginning of their time in the United States become accustomed to discrimination. And over time, they develop coping mechanisms to help them offset the harmful effects that discrimination may have on their health overall. And this may be why the Blacks who have experienced racial discrimination or experienced just disenfranchisement throughout their time in the United States, that they're better able to cope with the COVID-19 or the stress related to COVID-19 relative to their white counterparts who experience discrimination or who experience similar or higher levels of discrimination. And so our summary of the findings. So number one, beginning we showed, or I showed, that Blacks and Latinos bear the burden of COVID-19 related deaths in the United States. Despite this, they tend to have lower psychological distress scores than their white counterparts. And we see that Blacks, but to a lesser extent Hispanics, who face discrimination on a regular basis, Blacks who face discrimination on a regular basis, have psychological distress scores that are lower than most Blacks and than most whites and Latinos, regardless of how they face discrimination. And so future research questions, my colleagues are using data from multiple sources to examine how not only discrimination, but how COVID-19 related stress relates to psychological distress, reports of psychological distress and other physiological outcomes among adults, especially older adults. And so particularly, we know that discrimination, mistreatment itself tends to wear the body down over time. In this case, Blacks who reported discrimination tend to have better mental health, but understanding how it affects physical health is also a line of research that we're investigating, as well as which racial differences in how they perceive perceptions of the seriousness of the COVID-19 outbreak in the United States. This will be the end of the presentation. Thank you for your time, and I'm interested in your questions.
Well, let me start by saying excellent presentation, really timely and incredibly important data for all of us to think about. I wondered if you could say a bit more, given that we have lots of sort of non-experts in the field, about this racial paradox in mental health. Because years ago, people used to talk about the Latino paradox in this. People who face disadvantaged circumstances somehow tried kind of prevailing nonetheless in terms of mental health outcomes. So here you're talking a bit about psychological distress. Has this been shown in other aspects of mental health outcomes? And just say a little bit more about it if you could. Thank you.
So the racial paradox in mental health. So despite low SES, lower social standing in the United States, research for the last 25, 30 years tends to suggest that Blacks have better mental health than their white counterparts. Now, there are some measurement problems. People will say, well, perhaps it's a measurement issue, but we're seeing to find that even with a more precise measures of mental health, we still find this paradox. And so what exactly is it? And so it's pretty much a story of resilience that over time, because Blacks have experienced mistreatment at an earlier age, that they begin to build up resilience. Those who survive build up resilience. And that when, as individuals age and face more stressors, more exposure to stress, that they're able to cope in ways that are different, which is why, particularly among adults, we find that Blacks have better mental health, regardless of whether it's major depressive disorder, depressive symptoms, psychological distress, social anxiety disorder, so on and so forth.
So it's a very pervasive finding with lots of different aspects of mental health functioning. The other thing that kind of caught my eye and that I haven't been paying attention to much in the news was the graphs that you shared on the weekly number of deaths. Obviously, we've all seen lots of information about minorities having disproportionate burdens there. And so the Black and Hispanic graphs were higher. But what was surprising to me that I didn't know about is that the African-American graphs were trending down now, whereas the Hispanic deaths were still substantially higher. Is this a pattern that's quite stable right now? What's going on there?
It is, and so the graph, it didn't show the time portion. It went into July of 2020. There's some debates on how states are reporting the deaths, but it seems to be a fact because Hispanic Latinos are in portions of the United States such as Texas, where they were slower to test. So now you're seeing an increase in diagnosis among Latinos as well as an increase in deaths.
Okay. A question from one of those in the audience asks if you think that there's medical racism playing a role in the disparities with respect to COVID-19 deaths.
I do. And so I spoke to one of my colleagues who works in a hospital that treats, I won't say where, but they treat a number of COVID-19 patients. And so in her experience, she reminded me that hospitals are businesses, and the way they function is that they may turn away certain people at earlier points in order for them to come back at later points when the conditions are more severe. and then they cost more to actually recover. And so in this case, I know personally I have family members as well as friends that have died from COVID-19, and the cases always have a familiar, there's always a familiar element to the story of, I went to the doctor's office, they turned me away. I saw other people that were being treated and that were taken in, their symptoms weren't as mild, weren't as serious as mine. And so yes, I personally believe that medical racism or medical discrimination may contribute or contributes largely to we see racial disparities in COVID-19 related deaths.
Have you been able to look at any age groupings, sort of dividing some of your broad demographic categories by age? And what are the general patterns there?
And so we see for that older adults are more likely to think of the coronavirus as a more serious, has a minor, what is it? So Pew asked a question, does COVID-19, does it represent a serious threat to one's personal health? And we see older adults across the board, particularly older Blacks, who have reported that it makes a major threat to their health. And we find that, among older adults, the racial paradox and mental health persists. And we find that the relationship between perceiving COVID-19 as a serious threat, to a major threat to one's health, and psychological distress is stronger among older Blacks than it is their white and Latino counterparts. And so it's essentially for older Black general population, those beliefs are causing more stress, and this relationship remains stable over months.
Okay. A few people are interested in sort of the notion of discrimination. It's a big idea, can encompass a lot of things. So I know you've got a couple different kinds of discrimination in the research that you've done, but do you also include things like sort of systemic discrimination, things like redlining, big institutional patterns of discrimination? Could you talk a bit more about sort of the general effect of discrimination and how you might unpack it empirically?
Sure, unpacking empirically. And so Pew, in many ways, Pew offers a residential segregation scale. And so there are some that find that residential segregation or segregation of groups in residential and housing contributes to health disparities in the United States. And so one project that we're in discussions with Pew is to gain access to because this survey data that I presented today is a long panel survey, to gain access to some of the indices of dissimilarity, to examine how residential segregation contributes to COVID-19 related stress, as well as how those combine to contribute to psychological distress among adults across age groups.
Okay. We have a methodologist in the audience, I think, who's asking the great question about reporting things of this sort in a self-reported way. So it's like, if I answer a 5 on a scale, where it's 1 to 5, does that mean the same thing as you answering a 5 or someone else answering a 3? So the question is, could there be differences across the demographic groups in terms of where they would rank themselves for any given level of discrimination? Tough question.
Right, and so stress researchers tend to suggest that if people believe it's real in its consequences. And so what I've shown in some of my earlier work is that, and work that's going out, is that whites are reporting similar, if not higher levels of everyday discrimination than their Black counterparts. And this data comes from the PSYCH, Panel Survey of Income Dynamics, especially as they age. And so I know of people who conduct the in-person interviews. And so when they ask further, what types of discrimination do you face? I think a professor at Rice, he worked on a project, the National Survey of American Life, and he asked the white respondents, well, what's discrimination for you? And one white respondent, just anecdotal, said, well, I think it's unfair that Blacks get a better tan than I do, that their skin color is different and they can hold that skin color and I can't. Which, if you ask for Black respondents, when they refer to discrimination, there are different types of experiences, qualitatively different experiences of being either major instances being pulled over and harassed by the police, or minor instances being treated as though you weren't as smart, or being unfairly treated in restaurant settings and perhaps being kicked out or threatened. That these are, they're based off of self-reports, and this is a great question. But yes, I believe there are qualitative differences. There are some efforts to start doing more race-specific scales, and so scales that are relevant to items, including items that are more relevant to Blacks and relevance that are more relevant, items that are more relevant to, or questions more relevant to whites and Latinos, to see how they actually, and then test to see if what we think is actually happening is that they're understanding discrimination differently. But the ironic thing is that when we look within racial groups, it's a linear, more discrimination or higher reports of racial discrimination, poor mental health, or higher levels of psychological distress.
Right. It surely means something, but the measurement issue it's a tough one, no question about it. A few people have been interested in sort of the disproportionate presence of Black and Hispanic workers in sort of frontline essential jobs and how this may put them at a higher risk of COVID. Any thoughts about sort of the occupational distribution and health risks?
Yes, and so what we find, I think some of Tony Miles, who is a full professor at UGA School of Public Health, for retired individuals. And so we see that there are certain spikes among Blacks. And one of those spikes tends to be among Blacks who are in retirement homes. And so especially in Atlanta, those Blacks who are in retirement homes, that they're leading their age group in terms of COVID-related deaths because it's spread quickly in retirement homes than others. But also there's occupational differences. So Blacks who work in Walmart or on the front line where they have to interact with people, and sometimes those interactions aren't as safe, are more at risk for COVID-19 than others groups in the United States, just because of how their job requires, what their job requires them to do. Excuse me.
Right. It's a tough set of issues. Listeners interested in whether there's any good data on other racial groups, for example, like Asians, and exposure and deaths and things like that, which I can't say I see much of in the press.
Exposure to deaths, no, I don't. The CDC and the federal government would have that type of data. In terms of public opinion data with Asian Americans, I believe there are a series of people who are using YouGov, which is an online panel, and also, but that's restricted data to get at how this affects Asian Americans differently. We know that at least Pew Research Center, so they have data that's forthcoming next year. At least the preliminary results that they released suggest that Asian Americans are reporting higher exposure to discrimination after the COVID-19 outbreak than they have in the past, as well as other racial groups, or most other racial groups. And so that's pewresearch.org. I think they'll release that within the next 9 months, but the write-up is available on their website.
Okay. Another question is about sort of the possible effect of sort of whites feeling more comfortable seeking care in treatment over other groups that may feel there are greater barriers to receiving care for symptoms of COVID-19. Does that play into your sort of account of medical racism or
in part? And
concerns
so
there?
In part, and so the directions that different having more information matters, but the directions that certain organizations provide to individuals, like when do you go to the hospital when you feel symptoms and it's serious? And so, well, what does actually the serious mean? There's a colleague, his father actually, he exhibited all of the COVID-19 symptoms. He should have been in the hospital days before he passed. But in his mind, his father spent time in the military, I can sleep this off, so on and so forth, which just over time led to him, eventually by the time they got to him, he only had hours left, wasn't able to make it to the hospital before he passed. And so having more information, being more comfortable, and going to the doctor more often, I believe also matters, or is a factor that predicts racial or may explain some racial disparities in COVID-19 related deaths, but also having access or understanding a certain type of medical information that's presented to you.
Okay. Do you think that this has changed? So one of the listeners is interested in whether the evidence about psychological distress among the groups would be, say, different now, many months into the pandemic than it was earlier when the data was collected.
Sure. So I use data that came from March. So they've seen that there's increasing levels of psychological distress. I believe they collected in April and they collected it again in May. And so at least the descriptors through Pew's sites will still show these racial differences and psychological distress hold going into the summer. 6 months in, In the general population, you see these racial gaps in psychological distress. And so when we surveyed individuals, I think in 24, or when other surveys, those panel, excuse me, that was National Survey of American Life, 2001, 2003. If you go further, more recent data still picks up these racial differences in psychological distress. And so we find that in the general population over time, but this is especially more pronounced during the COVID-19 pandemic. And so I expect the gaps, if there is change, for the differences to be even more, for them to be increased, the gap between Blacks and whites and Latinos and whites to a certain extent to increase as time goes on during the pandemic.
Okay. A few people are interested in how it seems disappointing and odd that exposure to discrimination leads to better mental health somehow. This resiliency idea. And I can say that when I first read some of your work on this, I was quite puzzled and taken aback by it. Drew lines in the margins that think about this, and I have. Can you talk a bit more about like that issue, and does it apply also to physical health? And sort of thoughts on how we might change this.
And so it's great questions. And so most of our survey data, at least within racial groups, as I show, distress tends to have negatively affect mental health, regardless of the outcome. Depressive symptoms, major depressive disorder, so on and so forth. But across racial groups, which is, I think the work that I showed, it wasn't on distress, but it was on inflammation. We find it has differential effects on how race combines with experience of discrimination in ways that Blacks who face greater exposure to discrimination actually have better health outcomes than their white counterparts. We often find this in all-cause mortality risk.
Right.
And so I think the question is, I believe the question was about how it's disappointing to find. I think it's just more of coping. And so just being a Black, Latino in the United States, if you were to survive, you have to find ways to cope with discrimination. And over time, so as individuals age, especially in late life, they experience, for whites particularly, age-related discrimination, especially if they are in work settings. And so those discriminations may be new to them, but for Blacks, the experience of discrimination as a whole is not something that's new. It's something that they've experienced for the majority of their life. And so it's just it's more of a coping story than anything else, at least in my view.
Now, has there been any data that you've been able to look at that's sort of pulls apart sort of generational differences? So like, is a third generation Asian American different than a first generation, or say immigrants from Africa versus those who have been in the country for quite some time? Any differences of that sort in the evidence you've seen?
So that the generation data among Asian Americans, the surveys are fewer and far between. I believe they find generational differences. And so typically older individuals tend to report less exposure to discrimination than their younger counterparts.
Right.
Typically. But across, so it's another paper that my colleagues and I will send out this week, uses data from panel survey from income dynamics to transition to adulthood portion. And so what we look at is how race combines with gender to shape exposure to discrimination as adolescents transition into adulthood. And what we find is that over time, that white men, as they transition to adulthood, are reporting greater exposure to everyday discrimination than that changes differently, that Latinas, Black women and white women are reporting lower exposure to discrimination than white males. And Black and white men report no differences in the Black and white men, all Latinos, regardless of gender, Black women and white women report lower exposure to discrimination over time. The only group they don't differ from are Black men. And so as individuals are aging, we still see that there are some very odd differences in their exposure to the everyday hassles or discrimination.
Have you seen evidence on, say, support measures, and to see if some of the mental health differences you observe could be due to different levels of, say, community support or relationships with neighbors and things like that? So
my colleague Don Muzan answered that question with relationships, and so explained some of the differences in the Black-white mental health paradox, is what some scholars call social relationships, I believe, and social support. I think she focused more on relationships. explain some differences, but not all. And so it's still an ongoing question. We would think that SES, discrimination, social support would explain these differences, and we've not found it as of late.
Yeah, because that's a classic measure to look at in most of the sociology of medicine for quite some time. So a final question that's posed is a really big, important policy question. I've been kind of saving it for a while. And it's whether you believe that the racial disparities in who's experiencing COVID-19 and its consequences, say unemployment and so forth, is affecting policies that are guiding the way we deal with COVID-19.
I believe so. I believe that if this were happening to other, if we saw the reverse, and that we saw white Americans dying at higher rates from COVID-19 than Black and Latinos, then we would see more urgency in terms of dealing with the pandemic.
Yeah, it's a really big and important issue of our day. Well, thank you, Ryon. I have enjoyed your presentation, and I can tell you I am absolutely thrilled that you will be joining us momentarily, really, here for the fall semester at the University of Georgia. And I want to thank everybody who attended today and the people who offered such interesting questions. I tried to muddle through them as best I could, and I hope I did an okay job representing your interests. I would like to say that, you know, we are a university that's always in need of funds for students, for research. You know, we have a departmental fund in sociology that we use to help support travel and research opportunities for young scholars like Dr. Cobb, and for graduate students and others in the department. But the Franklin College is an extraordinary enterprise. And in the fiscal times we face right now, we really need the support of those who know what it's like to be a bulldog and who've been here and benefited from the education that we offer at the University of Georgia. I can't earmark any particular fund as being something that I think is more worthy than others. I give every month myself because I see in a very direct way how it affects students and how it can shape research opportunities here at the University of Georgia. I would like to point out that Ryon, Dr. Cobb, was hired under a presidential strategic and hiring initiative. So President Moorhead earmarked some money to bring in scholars who were doing cutting edge research that spanned different disciplines and would really help link us, say, in sociology to those in the health sciences. And so things like that happen because we have awesome alums that support the institution. So I hope that you continue to express your sort of gratitude to the institution and your ties to Georgia and support us as best you can. So I want to remind you, though, too, that this is the first, I believe it was the kickoff of the Ask Me Anything series for the fall, and that we're going to be having upcoming sessions on alumni.uga.edu. So there will be information about things that come. And so thank you very much for being here today and for participating. So thank you, Dr. Cobb, and thanks to all in the Alumni Association and the college that put all this together. We're honored as the sociology department to be the kickoff presenters here today. So thank you very much.
Thank you.